The overnight nurse had difficulty with blood draws and didn't collect them until late. You're just now getting the results first thing on your shift. Which lab value requires immediate intervention? Select all that apply. A. Sodium 132 in patient with SIADH. B. Potassium 6.2 in patient with renal failure. C. Calcium 7.8 in post-thyroidectomy patient D. Magnesium 1.2 in patient on furosemide E. Glucose 220 in patient with type 2 diabetes. Hey there, nurses-to-be. Make sure you study with us and subscribe to Yes, You Can. So how do you prioritize the labs? Critical labs suggest in impending, life-threatening situations. Which labs are most acute? And context matters here. So which lab values need immediate intervention? It's a select all that apply. There were 3. Did you get B with a K of 6.2 in renal failure? C with a calcium of 7.8 in a post-thyroidectomy? And D with a mag of 1.2 on Lasix? Let's break it down. High and low K is always dangerous, leading to issues in the cardiac muscles and lethal arrhythmias. Elevated K means calcium gluconate to protect the heart, and insulin and dextrose to move the K into the cells, and dialysis for some. Hypocalcemia in a post-thyroidectomy patient screams parathyroid damage. Low calcium causes neuromuscular irritability. This is a post-surgical emergency requiring immediate replacement. Hypomagnesemia is critical because low magnesium causes cardiac arrhythmias and seizures, especially in patients on loop diuretics that waste magnesium. Immediate mag replacement needed. So what about the wrong answers? Sure, the sodium is low, but it's mild hyponatremia, and this patient has SIADH, where you would expect dilutional hyponatremia. Expected and not critical result. A glucose of 220 in a known diabetic is an emergent. Address it with their scheduled insulin. Monitor and treat. Some electrolytes can never be out of range, like potassium, while others vary based on the patient's condition, like sodium and glucose. Know your normal lab values and remember, glucose varies based on meals, history of diabetes, and insulin schedule. Critical labs require immediate action to prevent complications and protect your patients. Like if you think scrubs are super cool, and subscribe so that, yes, you can master critical labs for your NCLEX.